Hey, Alpha Nurses, I'm Licensure from alphanursguide.com. This is 30 practice questions. With out the way, let's get started.
A nurse is caring for a client who is exposed to a stressful event. Which statement about the general adaptation syndrome should the nurse consider when caring for this client? 1. A stressful event is an iatrogenic stress. 2. An individual exposed to a stressful event will adapt in a unique way. 3. A stressful event will precipitate an autonomic nervous system response. 4. An individual exposed to a stressful event eventually will achieve homeostasis. The correct answer is 3. A stressful event will precipitate an autonomic nervous system response. Rationale. Stressors precipitate the general adaptation syndrome, which is a neuroendocrine response and part of the autonomic nervous system. A nurse gives a client in a nursing home a choice about which color shirt to wear. Which level need, according to Maslow's hierarchy of needs, has the nurse just met? 1. Self-esteem. 2. Physiological. 3. Safety and security. 4. Love and belonging. The correct answer is 1. Self-esteem. Rationale. Choosing which color shirt to wear provides a person with the opportunity to make a choice and supports feelings of independence, competence, and self-respect, which all contribute to a positive self-esteem. A nurse cares for a group of clients. A client experiencing which of the following situations does the nurse anticipate will have the hardest time coping? 1. Scheduled for a biopsy. 2. Unable to control the course of illness. 3. Challenged by a multiplicity of stressors. 4. Having to relocate to an assisted living facility. The correct answer is 3. Challenged by a multiplicity of stressors. Rationale. As the multiplicity of stressors increases, it becomes harder for a person to cope. As each stress is added, the accumulated impact is greater than just the sum of each individual stressor. Which is the primary purpose of the American Nurses Association Standards of Clinical Nursing Practice? 1. Define the philosophy of nursing practice. 2. Establish criteria for quality nursing practice. 3. Identify the legal definition of nursing practice. 4. Determine educational standards for nursing practice. The correct answer is 2. Establish criteria for quality nursing practice. The American Nurses Association Standards of Clinical Nursing Practice describe the nature and scope of nursing practice and the responsibilities for which nurses are accountable. A philosophy incorporates the values and beliefs about the phenomena of concern to a discipline. The American Nurses Association Standards of Clinical Nursing Practice reflect, not define, a philosophy of nursing. Each nurse and nursing organization should define its own philosophy of nursing. The laws of each state define the practice of nursing within the state. Educational standards are established by accrediting bodies, such as the National League for Nursing Accrediting Commission, the Commission on Collegiate Nursing Education, and state education departments. Nursing practice is influenced by the doctrine of respondeat superior. Which is the basic concept related to this theory of liability? 1. Nurses must respond to the Supreme Court when they commit acts of malpractice. 2. Healthcare facilities are responsible for the negligent actions of the nurses whom they employ. 3. Nurses are responsible for their actions when they have contractual relationships with clients. 4. The law absolves nurses from being sued for negligence if they provide inappropriate care at the scene of an accident. The correct answer is 2. Healthcare facilities are responsible for the negligent actions of the nurses whom they employ. The ancient legal doctrine respondeat superior means let the master answer. By virtue of the employer-employee relationship, the employer is responsible for the conduct of its employees. This is unrelated to respondeat superior. Negligence and malpractice, which are unintentional torts, are litigated in local courts by civil actions between individuals. Individual responsibility is unrelated to respondeat superior. A nurse can have an independent contractual relationship with a client. When a nurse works for an agency, the contract between the nurse and client is implied. In both instances, the nurse is responsible for the care provided. This is unrelated to respondeat superior. Good Samaritan laws do not provide absolute immunity. Nurses must function as a reasonable, prudent nurse would function in a similar situation. Nurses can be held responsible if there is gross departure from the normal standard of care or if there is willful wrongdoing on the nurse's part. A nurse completes an incident report after a client falls while getting out of bed unassisted. Which is the purpose of this report? 1. Ensure that all parties have an opportunity to document what happened. 2. Help establish who is responsible for the situation. 3. Make data available for quality control analysis. 4. Document the situation on the client's chart. The correct answer is 3. Make data available for quality control analysis. Incident reports help to identify patterns of risk so that corrective action plans can take place. The nurse who identified or created the potential or actual harm completes the incident report. The report identifies the people involved in the incident, describes the incident, and records the date, time, location, actions taken, and other relevant information. Documentation should be as factual as possible and avoid accusations. Questions of liability are the responsibility of the courts. An incident report is not part of the client's clinical record, and reference to the report should not be made in the client's clinical record. A nurse must administer a medication. Which should the nurse do first? 1. Verify the prescription for accuracy. 2. Check the client's identification armband. 3. Ensure the medication is in the medication cart. 4. Determine the appropriateness of the prescribed medication. The correct answer is 1. Verify the prescription for accuracy. The administration of medications is a dependent function of the nurse. The primary healthcare provider's prescription should be verified for accuracy. The prescription must include the name of the client, the name of the drug, the size of the dose, the route of administration, the number of times per day to be administered, and any related parameters. Although checking the client's identification armband is essential for the safe administration of a medication, it is not the first step when preparing to administer a medication to a client. Although ensuring that the medication is available may be done as a time management practice, it is not the first step when preparing to administer a medication to a client. A nurse is legally responsible for the safe administration of medications. Therefore, the nurse should assess if a medication prescription is reasonable. However, this is not the first step when preparing to administer a medication to a client. Which assessment data warrants immediate intervention for the client in labor who is receiving an oxytocin infusion via pump? 1. The uterus periodically becomes hard and firm. 2. The client reports an urgency to void. 3. The client denies the urge to push. 4. The fetal heart rate does not return to baseline. The correct answer is 4. The fetal heart rate does not return to baseline. During a contraction, the fetal heart rate will decrease, but should return to the baseline fetal heart rate after the contraction. If this does not occur, it indicates the infant is in distress, and this warrants immediate intervention. This could also be a sign of uterine rupture resulting from overstimulation of the uterus. The oxytocin infusion should be stopped immediately. The uterus becoming hard and firm periodically indicates a contraction, which is expected when administering a uterine stimulant. The client wanting to urinate would be expected because the baby's head is pushing against the bladder. Denying the urge to push indicates the client is not in the last stages of labor. The nurse is preparing to administer topical benzocaine to a client with a 4th-degree episiotomy. Which interventions should the nurse implement? Rank in order of performance. 1. Position the client on the side with top leg up and forward. 2. Wash hands and don non-sterile examination gloves. 3. Check the client's MAR with the identification band. 4. Ask the client if she is allergic to any cane drugs. 5. Apply the benzocaine to the perineal area. The correct order is 3. Check the client's MAR with the identification band. 4. Ask the client if she is allergic to any cane drugs. 2. Wash hands and don non-sterile examination gloves. 1. Position the client on the side with top leg up and forward. And 5. Apply the benzocaine to the perineal area. The nurse must first determine if this is the right client receiving the right medication. The nurse should always check for allergies. With this medication, cane drugs are anesthetics, and if the client is allergic to lidocaine or novocaine, the client should not receive this medication. Once the nurse determines that this is the right client to receive the right medication and that the client has no allergies, then the nurse must wash his or her hands and use gloves to administer a medication to the perineal area. The position on the side with top leg up and forward allows maximum exposure to the area that should be medicated. After completing all the previous steps, the nurse can apply the medication. The nurse is teaching a pregnant client diagnosed with tuberculosis infection about treatments during pregnancy and effects on her newborn. Which statement indicates the client understands the client teaching? 1. My baby will be born with TB and will be given isoniazid to treat the infection. 2. I will not be able to breastfeed, or my newborn could contract TB. 3. I should take supplemental pyridoxine during my pregnancy. 4. I will not take any medications to treat my TB until I have delivered my baby. The correct answer is 3. I should take supplemental pyridoxine during my pregnancy. Pyridoxine is recommended for pregnant clients with TB infections to ensure the fetus gets necessary vitamins. The infant will be tested for congenital TB. However, perinatal transmission is rare. Breastfeeding is not contraindicated in latent TB. Isoniazid, rifampin, and ethambutol are taken daily during pregnancy for treatment of TB. The nurse is preparing an amnio infusion for a client who is experiencing severe variable decelerations of the fetal heart rate. Which solution should the nurse expect to administer through the intrauterine pressure catheter? Select all that apply. 1. Normal saline. 2. 5% dextrose in water. 3. Lactated Ringer's solution. 4. Albumin 25% solution. 5. Dextrose and saline. The correct answers are 1. Normal saline and 3. Lactated Ringer's solution. Normal saline is used in amnio infusion. It can cause slight changes in fetal electrolytes, but is an acceptable fluid. Lactated Ringer's solution is the preferred fluid for amnio infusion. 5% dextrose in water is not indicated for amnio infusion. Albumin is a blood product prepared from plasma and is not used for this procedure. Dextrose and saline is not indicated for amnio infusion. The nurse is preparing to administer medications in the antepartum unit. Which medication should the nurse question administering? 1. Terbutaline to a client preparing for an external cephalic version. 2. Hydralazine to a client diagnosed with preeclampsia. 3. Methotrexate to a client with an ectopic pregnancy. 4. Prochlorperazine to a client diagnosed with hyperemesis gravidarum. The correct answer is 4. Prochlorperazine to a client diagnosed with hyperemesis gravidarum. Prochlorperazine is contraindicated in pregnancy. Ondansetron and promethazine are more common medications for nausea and vomiting in pregnancy. Terbutaline can be administered to the client preparing for an external version to relax the uterine muscle for manipulation of the fetus. Hydralazine is commonly used for elevated blood pressure in pregnancy. Methotrexate, a folic acid antagonist, is used for medical management of an early ectopic pregnancy with an intact fallopian tube. The nurse is teaching the pregnant client diagnosed with HIV about methods to prevent transmission to the infant. Which information should the nurse discuss with the client? Select all that apply. 1. The client will take zidovudine PO, regularly beginning at 12 to 14 weeks gestation. 2. The client's newborn should receive oral zidovudine 8 to 12 hours after birth. 3. Breastfeeding should be encouraged to provide the infant passive immunity to HIV. 4. If treated in early pregnancy, the risk of transmission of HIV to the infant is 1% or less. 5. All clients diagnosed with HIV must have a cesarean delivery at 38 weeks gestation. The correct answers are 1. The client will take zidovudine PO regularly beginning at 12 to 14 weeks gestation. 2. The client's newborn should receive oral zidovudine 8 to 12 hours after birth. And 4. If treated in early pregnancy, the risk of transmission of HIV to the infant is 1% or less. Zidovudine is given orally, as directed, around the clock. The newborn should receive oral zidovudine syrup beginning 8 to 12 hours after birth until 6 weeks old. The Centers for Disease Control states that if the client is treated beginning in early pregnancy, the risk of transmission of HIV to the infant can be reduced to 1% or less. Breastfeeding is not recommended because HIV is present in breast milk. The choice of delivery method, vaginal or cesarean, is dependent on the concentration of the virus in maternal plasma. Cesarean delivery before the onset of labor and rupture of membranes can reduce the transmission of the HIV virus. However, the method of delivery needs to be individualized to each client. At a preconception visit, the nurse instructs the client on the importance of folic acid in the prevention of serious birth defects. Which statement to the nurse indicates the client needs more teaching? 1. I will increase my intake of spinach, orange juice, and almonds. 2. I will increase my intake of milk, yogurt, and fish. 3. I will take my prenatal vitamin with folic acid daily. 4. I will avoid overcooking my food to prevent vitamin loss. The correct answer is 2. I will increase my intake of milk, yogurt, and fish. Milk, yogurt, and fish are not a source of dietary folic acid. Green leafy vegetables, citrus foods, and nuts, such as peanuts and almonds, are rich in folic acid. A prenatal vitamin with 400 micrograms of folic acid is recommended for a client preparing for pregnancy or a client who is pregnant or lactating. Folic acid can prevent neural tube defects, cardiac defects, and cleft lip or palate. Folic acid can be lost when overcooking foods. Which medication categories are contraindicated in clients who are pregnant? Select all that apply. 1. Pregnancy category A. 2. Pregnancy category B, 3. Pregnancy category C, 4. Pregnancy category D, 5. Pregnancy category X. The correct answers are 4. Pregnancy category D and 5. Pregnancy category X. Category D medications have a proven risk of fetal harm and are not prescribed for clients who are pregnant unless the mother's life is in danger. Category X medications have a definite risk of fetal abnormality or abortion. Category A medications have a remote risk of causing fetal harm and are prescribed for clients who are pregnant. Category B medications have a slightly higher risk of causing fetal abnormalities than do Category A medications, but they are often prescribed for clients who are pregnant. Category C medications pose a greater risk than Category B medications and are cautiously prescribed for clients who are pregnant. Medications in this category have either not yet been the subject of research or may show a risk in animal studies. A nurse is facilitating a support group for people who are coping with the death of a significant other. Which client behavior reflects complicated grieving? 1. Remarrying within 6 months after the death of a wife. 2. Being continuously angry 3 months after the death of a parent. 3. Exhibiting indicators of depression 9 months after the death of a husband. 4. Keeping a child's room unchanged for 4 years after the death of the child. The correct answer is 4. Keeping a child's room unchanged for 4 years after the death of the child. Rationale. Keeping a deceased child's room unchanged for years is outside the usual limits of grieving. Often, a person can get stuck in a stage of grieving and is unable to progress to the next stage. Keeping a room unchanged for years reflects an inability to face the reality of the loss or to deal with the feelings associated with the loss. A nurse is assessing a child in relation to the stages of Jean Piaget's theory of cognitive development. Which behavior indicates that the child has reached the formal operation stage of cognitive development according to Piaget? 1. Utilizes deductive reasoning when examining alternatives. 2. Uses logical thought to organize collected information. 3. Investigates objects by placing them in the mouth. 4. Employs language to communicate with others. The correct answer is 1. Utilizes deductive reasoning when examining alternatives. Rationale. Utilizing deductive reasoning to examine alternatives reflects the formal operation stage of cognitive development. These individuals use symbols related to abstract concepts and are capable of hypothetical and deductive reasoning. A client with terminal cancer is willing to try new therapies. Which stage of Kubler-Ross stages of grieving does the nurse identify that the client is experiencing? 1. Denial. 2. Depression. 3. Bargaining. 4. Acceptance. The correct answer is 3. Bargaining. Rationale. A client in the bargaining stage of grieving seeks to avoid the loss and will try new therapies to gain more time. A nurse is considering the faith development theory by James Fowler while assessing several clients. Which clients does the nurse expect to assume responsibility for their own beliefs about faith? 1. Older adolescents. 2. Young adolescents. 3. Older school-age children. 4. Young school-age children. The correct answer is 1. Older adolescents. Rationale. Older adolescents and young adults assume responsibility for their own commitments, beliefs, and attitudes about faith. This reflects the individuative reflective stage of faith development. When attempting to administer a 10 p.m. sleeping medication, the nurse assesses that the client appears to be asleep. Which should the nurse do? 1. Withhold the drug. 2. Notify the primary healthcare provider. 3. Awaken the client to administer the drug. 4. Administer it later if the client awakens during the night. The correct answer is 3. Awaken the client to administer the drug. Administering a medication is a dependent function of the nurse. The prescription should be followed as written if the prescription is reasonable and prudent. This medication was not a PRN medication, but rather a standing prescription. This is a violation of the primary healthcare provider's prescription. Drug administration is a dependent nursing function. Notifying the primary healthcare provider is unnecessary. The drug should be administered as prescribed, not at a later time. A nurse says, "If you do not let me do this dressing change, I will not let you eat dinner with the other clients in the dining room." Which legal term is related to this statement? 1. Battery. 2. Assault. 3. Negligence. 4. Malpractice. The correct answer is 2. Assault. The statement in option 2 is an unjust threat. Assault is the threat to harm another person without cause. The statement in option 1 is not an example of battery. Battery is the actual willful touching of another person that may or may not cause harm. The statement in option 3 is not an example of negligence. Negligence occurs when harm or injury is caused by an act of either commission or omission. The statement in option 4 is not an example of malpractice. Malpractice is negligence by a professional person as compared with the actions of another professional person in a similar circumstance when a contract exists between the client and nurse. Which factor is unique to malpractice when comparing negligence and malpractice? 1. The action did not meet standards of care. 2. Inappropriate care is an act of commission. 3. There is harm to the client as a result of the care. 4. There is a contractual relationship between the nurse and client. The correct answer is 4. There is a contractual relationship between the nurse and client. Only malpractice is misconduct performed in professional practice, where there is a contractual relationship between the client and nurse that results in harm to the client. There is a violation of standards of care with both negligence and malpractice. Negligence and malpractice both involve acts of either commission or omission. The client must have sustained injury, damage, or harm with both negligence and malpractice. A nurse is informed that a credentialing team has arrived and is in the process of assessing the quality of care delivered at the hospital. Which organization is associated with the credentialing of hospitals? 1. The Joint Commission. 2. National League for Nursing. 3. American Nurses Association. 4. National Council Licensure Examination. The correct answer is 1. The Joint Commission. The Joint Commission evaluates healthcare organizations' compliance with standards stipulated by the Joint Commission. Accreditation indicates that the organization has the capabilities to provide quality care. In addition, federal and state regulatory agencies and insurance companies require accreditation by the Joint Commission. The National League for Nursing fosters the development and improvement of nursing education and nursing service. The American Nurses Association is the national professional organization for nursing in the United States. Its purposes are to promote high standards of nursing practice and to support the educational and professional advancement of nurses. The client in labor has an epidural catheter in place for anesthesia. Which intervention is most important for the labor and delivery nurse? 1. Assist the client with breathing exercises during contractions. 2. Ensure the client's legs are correctly positioned in the stirrups. 3. Have the significant other scrub for the delivery of the baby. 4. Titrate the epidural medication to ensure analgesic effect. The correct answer is 2. Ensure the client's legs are correctly positioned in the stirrups. Because the legs are numb as a result of the epidural, the nurse must ensure the legs are in the stirrups correctly so that the client will not experience neurovascular compromise or any type of injury to the legs when they are in the stirrups. Breathing exercises are important, but the protection of the client's lower extremities while under anesthesia should be a priority for the nurse. Preparing the significant other for the delivery is important, but it is not a priority over the safety of the mother's lower extremities. The anesthesiologist or nurse anesthetist would be responsible for administering the anesthesia during the delivery. The nurse is assisting the certified registered nurse anesthetist in placing an epidural in a laboring client. Which findings would indicate intravascular injection of the local anesthetic? Select all that apply. 1. Tachycardia. 2. Pruritus. 3. Tinnitus. 4. Sedation. 5. Dizziness. The correct answers are 1. Tachycardia, 3. Tinnitus, and 5. Dizziness. Tachycardia is a symptom of intravascular injection of a local anesthetic. Tinnitus is a symptom of intravascular injection of a local anesthetic. Dizziness is a symptom of intravascular injection of a local anesthetic. Pruritus, itching, is a symptom of an allergic reaction. Intravascular injection does not cause sedation in the client. The nurse is caring for the pregnant client in labor. The client has had no prenatal care and reports being dependent on opioids throughout her pregnancy. Which interventions for pain control could be provided to this client? Select all that apply. 1. Epidural anesthesia. 2. Butorphanol IV. 3. Morphine IV. 4. Acetaminophen PO. 5. 1% lidocaine locally. The correct answers are 1. Epidural anesthesia. 3. Morphine IV. 4. Acetaminophen PO. And 5. 1% lidocaine locally. Epidural anesthesia is not contraindicated in the opioid-dependent client and is an acceptable form of pain management. If narcotics can be safely administered, the nurse should not withhold the medication during labor. Giving opioids during acute pain does not enhance an opioid-addicted client's chemical dependence. Acetaminophen administered orally can reduce pain in early labor. 1% lidocaine can be administered by the HCP prior to an episiotomy or for perineal repair. Butorphanol is a narcotic agonist-antagonist and should be avoided in the opioid-dependent client as it can cause acute withdrawal in the mother and in utero withdrawal in the fetus, characterized by fetal tachycardia and fetal death. The nurse is preparing to administer medication in a labor and delivery unit. Which medication should the nurse question administering? 1. Magnesium sulfate to a client diagnosed with preeclampsia. 2. Dinoprostone to a client diagnosed with asthma. 3. Betamethasone to a client who is 27 weeks pregnant. 4. Oxytocin to a client diagnosed with an incomplete abortion. The correct answer is 2. Dinoprostone to a client diagnosed with asthma. The synthetic prostaglandin dinoprostone is used cautiously in clients who have asthma because it can initiate an asthmatic attack. Therefore, the nurse should question administering this medication. The client with preeclampsia would be receiving the anticonvulsant magnesium sulfate to help prevent seizures. Therefore, the nurse would not question administering this medication. The corticosteroid betamethasone is a medication used to increase surfactant in fetal lungs and would be administered to a client who is less than 34 weeks pregnant. Therefore, the nurse would not question administering this medication. Oxytocin, a uterine stimulant, would be administered after a client has experienced an incomplete abortion to help the client expel the fetal fragments. Therefore, the nurse would not question administering this medication. The client who is 32 weeks pregnant and in preterm labor is prescribed terbutaline. Which data warrants intervention by the nurse? 1. The client's respiratory rate is 34 breaths per minute. 2. The fetal heart rate is 150 beats per minute. 3. The client's apical heart rate is 104 beats per minute. 4. The client reports no contractions. The correct answer is 1. The client's respiratory rate is 34 breaths per minute. Terbutaline, a beta-adrenergic agonist, causes bronchodilation, and if the client's respiratory rate is abnormally high, or if there is a change in quality of lung sounds such as wheezing, rales, or coughing, the HCP should be notified. The normal fetal heart rate is 110 to 160 beats per minute. Therefore, a fetal heart rate of 150 beats per minute is within normal limits and would not warrant intervention by the nurse. The client's apical heart rate is just above normal and would not warrant intervention by the nurse. Terbutaline is administered to prevent contractions. Therefore, the medication is effective. The pregnant client is prescribed metoclopramide to treat hyperemesis gravidarum. Which information should the nurse discuss with the client? Select all that apply. 1. Chew the tablet thoroughly before swallowing. 2. Take the medication 30 minutes prior to mealtime. 3. Do not drink any type of alcoholic beverages. 4. Muscle spasms are a common side effect. 5. The medication can cause drowsiness that will make driving unsafe. The correct answers are 2. Take the medication 30 minutes prior to mealtime. 3. Do not drink any type of alcoholic beverages. And 5. The medication can cause drowsiness that will make driving unsafe. The medication should be taken on an empty stomach at least 30 minutes before eating. Alcohol can increase central nervous system depressive symptoms of the medication and should be avoided. Metoclopramide can cause drowsiness. The client should avoid driving until the response to medication is known. The client should swallow the medication. The client should not crush, chew, or suck on the medication. Muscle spasms and rigidity are extrapyramidal side effects and should be reported to the HCP. The client who is pregnant is prescribed ferrous sulfate. Which statement indicates to the nurse the client needs more teaching? 1. I should increase my fluid intake and fiber when taking this medication. 2. I will take a daily stool softener to prevent becoming constipated. 3. If I notice that my stool becomes black or dark, I will call my obstetrician. 4. I should take my iron tablet 2 hours after I eat. The correct answer is 3. If I notice that my stool becomes black or dark, I will call my obstetrician. Ferrous sulfate, an iron product, causes the stool to become black and tarry. Therefore, the client would not need to notify the obstetrician. The client should increase fluid and fiber to help decrease the possibility of becoming constipated. The client is instructed to take a daily stool softener to prevent constipation. Iron should be taken between meals, 2 hours after a meal, because food decreases absorption of the medication by 50% to 70%.
You can get my NCLEX course review. Links will be in the description. I'll see you guys in the next video.